Hi, I'm Trevor Magee. I'm a second-year medical student at Oklahoma State College of Osteopathic Medicine, and today I will be presenting a poster over the reporting of harms in randomized controlled trials published in urology journals. This is an updated analysis. I'd also like to thank Reese Anderson, Andriana Pena, Dr. Bradley Johnson, Del Perkins, and Dr. Matt Vassar for their contribution on this poster as well. In 2004, the Consolidated Standards for Reporting Clinical Trials Group, also known as the CONSORT Group, published a harms extension to their checklist to ensure randomized controlled trials properly report on adverse events within trials. A 2010 study found suboptimal reporting of harms within studies published in the top urology journals in 1996 and in 2004. Our objective was to determine whether their study influenced the completeness of harms reporting in subsequently published RCTs within the same journals. We sought to conduct a follow-up analysis to determine 1, how well the top urology journals meet consort harms criteria for reporting, and 2, to what extent has harms reporting improved since the original publication in 2010. We use PubMed to search and to identify all randomized controlled trials published within the Journal of Urology, Urology, European Urology, and BJU International from 2012 and 2020. These years were selected to provide 8-year intervals from the original publication. In similar methodology as the 2010 study, 2 authors independently evaluated each randomized controlled trial, meeting inclusion criteria according to the consort harms checklist. Using Stata 17.0, we analyzed trends in reporting and factors associated with the completeness of reporting. Our initial PubMed search yielded 200 potential articles from the urology-specific journals mentioned earlier, 132 articles from 2012, and 68 articles from 2020. Following title and abstract screening, 146 articles met criteria for inclusion and underwent full text screening, with a final analysis sample of 132 articles. Characteristics of the included studies can be seen on Table 1. The most common topic of RCTs included in our sample was oncology, followed by voiding dysfunction, while RCTs focusing on trauma and reconstruction were the least common. The majority of the RCTs were conducted as multi-center trials and reported a source of funding. From 2012 to 2020, the portion of reporting for individual criteria increased. Although not significant in most cases, there were significant increases in reporting for several of the consort criteria items, including Item 5, which showed that the RCT would plan to compare harms between groups, Item 7, which was the denominators provided for the harms outcome, and Item 8, which stratified between serious and minor harms. The median number of criteria reported increased significantly from 2012 to 2020. There were no significant differences between median number of criteria reported in journal of the publication, topic, intervention type, sample size, groups, funding source, or number of participating centers. In comparing our results from our analysis against the original study from 2010, the median number of criteria reported appeared to increase with each consecutive 8-year interval. The median number of criteria, which is out of 9, reported was 2.8 criteria in 1996, 3.3 criteria 2004, 5.3 criteria in 2012, and 6.9 criteria in 2020. Furthermore, the median number of criteria for each of the 4 journals increased from the original study to our study. In conclusion, we found overall the adherence to the consort harms checklist improved since the original publication in the Journal of Urology. Completeness of harms reporting is imperative for clinicians to make the most informed decisions for their patients' well-being. Our analysis found significant improvements in the randomized controlled trials published in the top urology journals, and we commend the authors and editors for their part in ensuring better reporting since the initial publication in 2010. I'd like to thank you for listening to my presentation, and down on the right hand of our poster, you can see our references. Thank you.